Caitlin Wilson can't imagine her son any other way.
I just think that people with ASD look at the world in a really pretty, beautiful way.
Her son, 8-year-old Elias, was diagnosed with autism from a young age, something she describes as a superpower.
I get so, I want to cry when I talk about him sometimes. I think that Elias is an extremely loving personality.
But new conversations about the disorder concern her.
The idea of wanting to put a Band-Aid on something that makes somebody human and get rid of it, all of that scares me.
The Trump administration recently described autism as an epidemic and linked taking acetaminophen, the active ingredient in Tylenol, while pregnant, to the development of autism.
There is not one thing that we can, let's say, blame for causing an autism spectrum disorder.
Dr. Patricia Notario, a special needs pediatrician at Billings Clinic, says there's not enough current evidence to back up that claim and that the disorder itself is complicated.
I think it's important to know that decades of research have already gone into looking at causes of autism, potential treatments for autism.
So she and other doctors continue to advise patients with the guidance from the American Academy of Pediatrics.
If there are recommendations that maybe come out that are not based on rigorous scientific evidence, that's misleading and that can be really dangerous for families.
The recommendations have been and remain that there is a benefit and safety to using acetaminophen in pregnancy.
And any claim that pregnant women won't harm their unborn babies by toughing out a fever, something OBGYN Jennifer Thompson says isn't true.
If we don't treat a fever, a mom has a risk of miscarriage, preterm labor, the baby can have neural tube defects or cleft lips.
Both Thompson and Notario agree moms-to-be should have conversations with their doctors first.
I'm not going to listen to somebody who's never had to deal with the hurdles of ASD and telling me that I'm doing it wrong or another parent's doing it wrong if they've never experienced it.
For Wilson, who didn't take acetaminophen during pregnancy, she says the claims put blame on mothers.
It's very overwhelming sometimes.
But she'll continue doing what's best for Elias.
But again, it's an incredible thing, and I'm happy to have a child with ASD.
In Billings, Isabel Sparts, MTN News.